Happy Monday, everybody. Welcome to the Greater Entrepreneur Success Group. So happy you've taken time out of your busy schedule to join us this morning to hear some dynamic information, but also to network. I am yours truly, Sinclair Gray, speaker, author, and success coach. Well, look, we have a small group right now. Maybe others may be joining. Let's go ahead and get started. Let's go ahead and tell me about who you are. Tell everybody who you are, because this goes out to YouTube, goes out to lots of people. So instead of the 7 seconds, Stevie, I will introduce you last. I will give everybody, oh gosh, a whopping 15 seconds. Lord have mercy, 15 seconds. Take advantage of it. We're gonna go with Ken this morning.
Ken Fainer, the social glue, social media marketing and email marketing that sticks. And that's exactly what I do for my clients. I make sure their message gets out there and people remember it and it sticks in their head.
Perfect. Ken, you just don't do just the ATL, you do all over, right? National and global.
Someone calls me from California, I talk to them. Yes, I've had clients all over.
That's perfect. All right, we got Hilda.
So good morning, everyone. So Ken, I'm gonna one-up you on that. If somebody calls me from California, I'm flying them in, getting them a delicious meal at Village Tavern. I'll fly them home. How about that?
Oh my goodness.
Hilda Anderson. That's a perfect world right there. Not the world we live in.
Perfect world.
My name is Hilda Anderson, and I am marketing associate at Village Tavern. We have served our community for 21 years. So my role at Village Tavern is to maintain and grow our presence. So on behalf of Village Tavern, I welcome and invite any of you in. If you have any special needs, group requests, networking, please feel free to reach out to me. I will put my information in the chat. Thanks so much for the time.
Perfect. Thank you, Hilda. Welcome back. We got Kimberly.
Good morning, everybody. Kim Hudson Gray, and my soon to open, I've been saying it for weeks, open store is Pearl and Accessories. It's turned out to be quite a learning experience as far as setting this whole thing up, but I'm excited about it and I'm wearing a piece now. I have a piece here. I'm waiting on more. It's just Swarovski crystal jewelry. I don't know if you can see that. This is actually pink, but it's showing up purple on here.
All right.
But anyway, pieces that make you pop. You're going to be on Zoom or even in person now. Things are opening up slowly, hopefully safely. But just a few little pieces to, make yourself stand out a little bit. Nothing too gaudy, just simple and classy pieces.
Cool. Thank you, Kim. Stephanie.
Good morning, everyone. My name is Stephanie Bolden. I am the Senior Business Development Officer for Lift Fund. And Lift Fund provides access to capital for startups as well as expanding businesses throughout the state of Georgia. We're there to give your business a financial lift when others say no.
Wonderful. Thank you, Stephanie. Well, everybody knows me. I'm your business trainer, success coach, and speaker. So I am now going to introduce you to Stevie, the insurance lady. She is with USH Advisors Health. She's a health insurance extraordinaire. I met Stevie about a month or two ago at a networking event. And here's the funny thing, those who know me well, I'm really big on elevator pitches. I heard Stevie's elevator pitch and I was like, no, and no. It was all, I was like, no, we need to talk. And we have been working together and it's been such a pleasure to work with. We've seen some dramatic improvements. She has seen improvements. But one of the things that we're talking about is health insurance, because all of us need to know about health insurance. So Steve, I just introduced you, but I see we got Eartha on. So I want Eartha to introduce herself. Eartha, you got 15 minutes. I'm gonna bring you on, Steve, to do your show.
15 seconds.
Welcome back, Eartha.
Hey, thank you so much. I am Eartha at Postkeeper CPR. We provide CPR and first aid training for people of all skills levels. However, our ideal clients are those in the medical field, such as doctors, nurses, or those looking to get into the medical field. I'm Eartha Levy with Postkeeper CPR in Conyers. Thank you.
Thank you, Eartha. Okay, Stevie, the show is yours, Stevie. You got about 18 minutes. Screen shares on, however you choose.
Okay, hello everyone. Yes, I am Stevie, also known as Insurance Lady Stevie, and I want to first start off by thanking Dr. Sinclair Gray for not only having me here today to share with you all something that's very dear to my heart, that's important to what I do daily with helping people daily protecting themselves and what's dear to their hearts, their health and their family's health, but also for coaching me and helping me become better. So I definitely do appreciate that, Sinclair. All right. So I thought today I would take it kind of like a laid back approach. Instead of me bombarding you all with information that could be and can be Googled, I figured I would make it interactive. So we're going to get everyone involved. I'm actually about to post in the chat and would like everyone to take a look at that post, which has the top 5 worry points of entrepreneurs. So I want to know from everyone, which of these top 5 worry points most concerns you? Either A, access to health insurance, whether that's meeting or keeping a full-time or part-time job so that you can make sure that you have access to health insurance, financial planning, adequately preparing for future or a children's education, C, access to a tax accountant, D, property and casualty, life insurance, estate planning, or E, attorney for marriage or children or anything of that nature. So if you can list that in there, either by putting an A to E, then we'll be able to take a poll and see which one most concerns most of the entrepreneurs that we have here today. And once you're done with that, you can also look up to me and maybe share with me what health network that you currently have. I've listed mine's below. I have a private PPO, United Healthcare Network. So we have Ken finished. Oh, Dr. Sinclair has a little bit of all of those concerns.
My fault. I was just looking at on my fault. I was trying to do it in order. I see Ken just chose one. Okay, Ken is smarter than me.
It's okay. It's okay. So Ken, since you are all complete, do you currently have insurance?
I do. I'm probably the oldest person in the room, so I just went on Medicare.
Okay.
So I'm Medicarized.
Good, good, good. And you were able to get your dental and vision taken care of also, because that's sometimes not included with Medicare.
Yeah, no, it's not included. I just did a supplement plan, and I've been paying for my own dental and stuff for years because I've been self-employed. And the other thing too was because we've been self-employed the past couple of years, we shifted over to something different that isn't really insurance, it's MediShare. Just because it was a way for us to save money, because we were about $1,600 a month on insurance. So
yeah.
It was killing us.
Unfortunately, thank you for sharing that, Ken. Unfortunately, that's the case for a lot of people that think that health insurance is unaffordable. So a lot of people don't have health insurance just because it's a little higher than they expected on having to pay. Not that it's not important, it's just more than they want or can afford to pay on health insurance. So definitely thank you for sharing again. And since we all are, looks like we all have posted, I'll just go ahead and start the discussion today. And what I thought that I would do would be to discuss and I hope my computer's not making noise. I'm sorry. I should have put it on airplane mode if I could have. I'm getting a couple of alerts, but we are discussing life changes and the demands for needs of health insurance, which leads us into the first point that was a worry point for a lot of entrepreneurs presented today, which is common health access. The protection that if the major what if were to happen, you can rest assured and sleep with reassurance that you and your family are covered, right? Top concerns. So I'm going to go over some of those life changes and reasons to have a policy review if you currently do have insurance, or to consider insurance for those that may not have it or may have thought it's not affordable. One change involves children on your plan who is no longer eligible to stay on your family plan or policy, because now they've come to an age that is past that age limit. That would be an example of downsizing within your household. Then there is a young adult that is going to college in another state. That state happens to be Georgia, at University of West Georgia. Penny called now the 5th insurance company for her son, Paul. He needed adequate health insurance to play collegiate sports at West University of Georgia. The family's previous plans were and included, but not limited to, short-term plans and an HMO plan. They didn't cover major medical or travel outside of the area in retrospective order. So Penny called me, and the whole family was eligible for a family PPO plan. That included dental and vision for a monthly premium of only $528. And that life change, if Penny and the family of 3 decided that they didn't need the coverage, Paul could have qualified for an individual PPO plan, also with dental and vision for a monthly premium of only $195. Now, isn't that great? That's one life change. Another life change of need to obtain health insurance is due to not having any, which is very, very common in times like this. That's why they extended the open enrollment to May 15th, because a lot of people didn't have health insurance. And with COVID, it's very, very important to make sure that if something were to happen, you're covered, because bankruptcy is very high with people that unfortunately have insurance. And you can imagine if you don't have insurance. So where do most people go when they're looking for information, right? I'm looking for information on insurance. Where do I go? This is for anybody to respond, please.
Probably
Internet.
Internet, or you got some friends you call up.
Both of you are correct. The internet or some friends, but that's where I went, to the internet. I was blessed to get on a plan, one of the plans that I help other people with every day. After reviewing the plan, the major concern was making sure that I could get a mammogram. After getting approved with my good health, not only did I get insurance, great insurance, before being diagnosed with breast cancer at the age of 35. 5 surgeries, weekly bills of $400,000 later, I was so glad that I found the right plan for the major what if that no one plans on having. In both of these success stories, thereafter can be the after for every American out there now. Everyone can afford to be able to have the questions answered regarding to your health insurance. So to wrap it up, I'm a great referral for Penelope that's downsizing, or to simply place your mind at ease as for any questions that you may have. Stevie, and I would love to be your insurance lady. Thank you so much. Do we have any questions?
I got a question for you. For those people who have children in college, and forgive me, I just don't know this, so for those who are watching, don't think I'm ignorant. Does high schools and colleges cover so much of a child's health when it comes to insurance? Okay, you're shaking your head. No.
Yeah.
What about athletes?
Well, it's not covered, but it's part of, well, my kids, I don't know if it's the schools that the boys who have graduated, it was part of their tuition. It was an insurance bill into the tuition unless they had private insurance.
Yes, and for this, the example that I talked about with one of my clients at the West University of Georgia, that in built-in tuition to help cover his collegiate sports was $5,000 annually. Not affordable at all for single mothers or for students that don't have support from their parents. So he was so grateful that not only was I able to find an acceptable insurance, because they had been down this road plenty times before, but that it didn't bust their pockets or their wallets in order to have that coverage that was efficient.
So what's the average cost for someone that's in grad school and basically that's their only, because I have my second son is in grad school currently, and he doesn't work because he's getting my military benefits to pay for his school.
Okay, so in his situation, it looks like it would probably be more beneficial for him to look at a plan in the public market, which would be the marketplace. I could help walk him through that, hold his hand through the whole process so that he can find something where he's getting a subsidy. If that makes sense for you and your family, for him to take advantage of that subsidy, that would be the best option. If taking advantage of a subsidy, it doesn't work for you and your family, then of course, looking at his good health and getting him something on the private market would be his better option. And Hilda, if you can post your information in the chat, I would love to follow up with you on more about information for your son's health coverage.
My information is in the
Oh,
chat,
that's-
but you might be
and-
thinking about somebody else.
Stephanie too. Yes, both of you guys. Stephanie, I was Eartha, please.
I have a question for you, Stephanie. Stevie, sorry.
Yes, it's okay.
So Stevie, my question is, just wanted to get some feedback from you about people that are potentially interested in looking at open enrollment. Is that something you just suggest, the person just walk through and kind of look at all their information, or do they need somebody to hold their hand through that process?
Well, it just depends on you. Everything is easier when you have somebody that does this every day and is able to walk with you through the whole process. And that's part of the benefits that you get for having Stevie as your insurance lady. So I walk with you and hold your hand through the whole process, even if that is looking at your options in the public market. So Hilda, I will reach out to you also and see how I can be of assistance to you and your family.
Thank you.
My
I
pleasure.
think also just wanted to let you know, I think that you might have been speaking to someone else about, my information is in the chat, but I think you might have
Okay.
been speaking to someone else about their son and healthcare. I can't remember what you were saying.
Yes, Eartha and Hilda. Eartha has posted
Eartha,
hers,
there you
I
go.
see. And I think I'm
Yeah.
sure I'll find yours, Hilda. Yes, yours is up top. You're the first one.
Yep, absolutely. Well, thank you so much too for sharing, because I think that a lot of this, what it comes down to is anytime you're dealing with people and insurance, there's just a lot of fear around it. People want to be, protected. People want to know that, that one incident isn't going to devastate them financially. So I think that the work that you're doing is very, very important. And I think it's nice to know someone. I've gotten to know a lot of different people through a lot of these networkings that are very, very generous in offering a helping hand to those who aren't familiar with this world.
Yes, I appreciate that. Thank you so much, Hilda. And that's what brings me joy to what I do. I have an enthusiasm about life. So being able to bring that enthusiasm on the customer service end with the expertise and knowledge that I have in the health insurance, it pleases me and I enjoy it. So it's fun.
That's great. That's good.
How do you help
Thank you.
someone to?
Any other questions?
Yes. How do you help someone to find the right policy for them? What kind of questions do you ask that helps to narrow down the best policy?
Okay, that's a great question. Stephanie, what questions I ask is, first off, when are you looking to make a change? When do you need to make a change? That is the first question, because if you need something because something's happening, then we need to talk about that. We need to talk about what your reasons are that you need health insurance, because unfortunately, a lot of people aren't as proactive as we would all love to be and have the insurance before something happens. Sometimes people want to get it because something has already happened and they want to make sure that they have it now that they know something has happened. So regardless of what your situation is, I just want to know when you want to get started, how much you can afford to pay. If you already have something, how much what you don't like about what you're already paying. Because we're going to make sure that it's something that is beneficial for you and does for you what you need, what's important to you. That's what we want to bring to the table. We don't want to bring to the table things that were concerning previously. Definitely not. So I ask questions pertaining to who I'm sitting with and how often you go to the doctor, questions like that, just to see how I can best help.
Thank you.
My pleasure, Stephanie. If you put your information in there, I'll also reach out to you. Definitely.
Now, I noticed one of the things that people were concerned, a lot of people were concerned about, Stevie, was going to being able to keep their same doctor. When they
Yes.
go through, can they keep their same doctor? Things of that.
Great question. And that's where, to make it really simple, if you look at the different types of networks, that lets you know where you may be able to keep your doctor because of your good health. So if you're looking at an HMO network, those are typically limited to within your zip code. So if it's within your zip code, your doctor, then you don't need a referral from a primary to go to a specialist because that specialist is within your zip code. Typically, those are like Kaiser Permanentes and self-standing facilities that have everything in one building. You may have a doctor outside of your zip code. You may have a need to see a specialist outside of a building that diagnosed you with a concern that you may not have. If those are things that are important to you, then you may not be able to find that doctor within your zip code. So you would need a PPO, which is a private network that allows you to not only go outside of your zip code, you're outside of your state. So if you're in a different state like Florida and you live in Georgia, but now you're on vacation and a major what if happens, you don't have to worry about those bills that are gonna come if you have insurance and they're not within your network, or the bills that will come definitely if you don't have insurance. So you want to make sure you have like the insurance that you can qualify for, and hopefully it's a PPO network, which gives you options to not have to have limited doctors. A larger network provides you more doctors.
Cool, thank you. Anybody else got any other questions real quick? It's your time to ask for as entrepreneurs.
Yes.
I have a question again. Sorry, Stevie.
No, you're good.
So for you, the people that are in insurance, how is it, this is something that is confusing sometimes. How is it that you all earn your income? Is it explain that to me. Would you mind just like, can understand?
Well, insurances are all different as far as incomes, but we get paid when we're able to help people. And the people that pay us are the companies that we work for. So we work for ourselves. We're like independent currently where I am. So I don't work for a specific insurance company. However, I'm able to help with different networks. So depending on the network that I'm able to help my client with, and that just depends on the person that I'm sitting with. And that is typically how it works with any like insurance period, depending on the company or the area that the help was rendered, that's who pays. So the money doesn't come from you actually paying for your service. It actually comes from the company paying for the services that they were able to render on your behalf.
Thank you. So if you are walking someone through Obamacare in an open enrollment, how does that look for you?
Yeah, so believe it or not, it's now Biden Care, and they
it's
Yep.
like an extension of Obamacare. Yes.
Yeah, it's the same thing. You have some people that really just don't want to hear anything about Obama or Biden Care Marketplace. It doesn't work for everybody, but for the ones that it is the best option and is able to work for them, the healthcare market actually does pay me for being able to refer them with people that they're able to help with health coverage also.
Would you say, in your expertise, would you say that it's best to take a look at do as much research as possible before decisions are made. And that includes Biden Care, the private sector, the public sector, all avenues of insurance before decisions are made.
Definitely. That's a great question, Hilda. I would definitely advise that. And that's also one of the benefits that I'm able to bring to the table. With Zoom, with COVID-19, we're all kind of like staying in our own little area. So this is like my own little area. And every day I sit with families all over the nation, and I'm able to sit down and share my screen with them, where I walk them through the whole process. We're not just looking at what I think might work for them initially, which is most likely the private market, because again, it gives you more benefits for your money. We look at all your options, and we typically start with the public market, because a lot of times the public market brings a lot of pain to some people. The premiums can be higher than a lot of people anticipate. Like Ken was mentioning, $1,600 for a husband and wife sometimes in the marketplace, not to mention the deductibles can be high too. So sometimes it takes you just being able to see it for yourself. And in the process of selecting the best coverage for my clients, I walk them through all 4 networks. So we look at the public market, we look at short-term plans. We look at anything else that you may be interested in if you have like an employee plan. And then we also look at the private market. And based on all of those, I ask you which one makes the most sense for you. And sometimes I end it with, now, does this plan work for you, or do we need a more expensive plan than that? Because a lot of times it's the plan that you didn't even hear about that makes the most sense for you, and it's the most affordable. So
How
it's
long
good.
have you been in the industry?
I've been in the industry for like 6 years, and it's good to have somebody like me in your court, Hilda. So even if I can't help you right now, there's someone that you know that may have been looking for health insurance, that may have a life change that needs to be discussed with someone like me. So it's always good to be able to have someone like me as a reference point. And I appreciate you referring my name and number to anyone that you know that I may be able to talk to about health insurance.
Thank you for your information.
My pleasure,
Thanks,
Hilda.
Steve. We got a few moments before we wrap up. I know we have some visitors that came in. I'm going to give you, you're going to be nice with it. Like, Kathy, you could be really happy with me. I'm giving everybody 15 seconds. So all you guys got 15. Kathy, Ms. Smith, 15 seconds. Tell us who you are and everything in 15 seconds. I'm gonna start with Kathy.
All right, good morning, everyone. I'm Kathy Bethune with Banco ZK. I am your commercial banker, financial partner. We provide financial solutions and services to small business owners, and primarily I do financing with business owners. Kathy Bethune, Banco ZK. Thank you.
Thank you, Kathy. Ms. Smith.
Good morning.
Oh my, it was
I am. Oh my goodness, that's the pollen. I am Tawanya Smith with Right Choice Motors, located in Covington, Georgia.
Buy your cars, use cars. She also does a lot of other things too. So
She does voiceover work.
exactly. Perfect. Miss George.
Good morning, everyone. Andrea George with Rapid Gourmet. Just telling you, eat healthy, stay strong, and happy Easter. Please follow us at IG at Rapid Gourmet. Have a great day.
Thank you, Andrea. And then we got Dr. Sable.
Happy Monday morning, everyone. I'm Dr. Sable. Y'all need any chiropractic care or doula services or acupuncture services, I do work with my husband. Please contact me at 770-760-0060. I do look forward to building relationships with you. I definitely want to give out a shout out to Dr. Sinclair for keeping my business doors open, and also for connecting me with Stevie, because we're hosting a health happy hour in May, getting patients and clients new health insurance. So please look out for that and much more. Thank you so much.
Thank you so much, Dr. Sable. Okay. Well, I want to thank everybody for taking time out of your schedule, come be a part of this. Stevie, I'm gonna give you the last 30 seconds. Oh, real quick before Steve, remember, it's important to follow up. If you don't follow up, you're losing money. This video will go out later on today. And if for some reason, if you didn't get anybody's information, feel free to call me, text me, and have everyone on the cell phone. Thank you so much. Thank you. Awesome job, Stevie. I'm very informative. So Stevie, you close this out in 30 seconds, Stevie.
Okay, well, if you have any
got your
questions
phone
about
number,
health
please.
cover,
Phone number.
oh, my phone number is 678-768-5529. Again, that's 678-768-5529, and I'll definitely put that in the chat. If you have any questions about health coverage, I've got answers. I give a personal touch, learning what is best suited for you. Not all health coverage is the same. I'm here to explain the difference. I answer all your questions, connecting the dots, and I do that with a passionate approach, utilized to help discover the best coverage for health insurance, life insurance, dental, and visions. So definitely Stevie wants to be your insurance lady or wants to answer your questions. Hope you guys have a great week and know that you are in control of your own destiny. I appreciate Sinclair and appreciate all of you guys.
Thank you, Stevie.
Thank you. Happy early Easter, everyone.
Yes, happy
Just wanna let you know,
Easter.
Stevie handles all 50 states. Just want to throw that out. She handles all 50,
Yes.
not just Georgia. So if you
Happy
know,
early Easter.
Yes.
perfect. Everybody have a great one. Connect and refer. Everybody have a great one.
Thanks. you
Very
too.
good. Take
Thank you.
care.
Bye.
Dr. Sinclair,
Yes.
can you hear me before I leave? You should
Yes.
be proud of the good work and counseling and coaching you've done. Stevie did a great
Aw.
job.
Oh, thank
So
you
great
so
job.
much. I appreciate it.
I know you've got to feel so good when you've, prepared someone to present and they're just following in the
Well,
good advice that you've given them. So good job. Good job, Stevie. Thank you.
thank you.
All right. Take care,
Y'all have
y'all.
a good one.
Bye.
I'll talk to you later.
Bye-bye.